Yeah.
Yeah, of course. We will allow you screen sharing, Priya.
Screen share ka, they've given me the
Dr. Tapaswini, you have been made the co-host, so you can share the screen. Hello, Dr. Tapaswini.
hello.
Dr. Tapaswini, you have been made the co-host. You can share the
Right.
scene.
I'm just doing my I'm getting the PPT
Okay.
on the screen.
All right. Anvita.
How do I go back? Yeah, we are going. How come I'm lost?
Namaskar, Jyotaji. Thank you for joining. Glad to see you.
Nice to see you. Tapaswini, are you all right?
Good evening, ma'am.
Good evening.
It's such a pleasure to have you always. Bye, just help me.
Stop your video. That's it.
नहीं I've lost it.
Good evening, everyone, and happy Holi also.
You are on mute.
Happy Holi.
Zoom कहाँ गया मेरा Zoom
Zoom पे तो हो.
मेरा presentation
She is checking out her presentation.
Okay. Hi, Priya.
Good evening. When you ask Dr. Tapaswini, are you all right? You should be asking me, Priya, are you all right? Because I'm hosting the Zoom.
Okay. You can expect lots of excitement.
Yes. Priya Tiwari, unmute yourself and remain on standby.
Good evening, ma'am. Yes, ma'am, I'm here only.
full screen.
हो गया. Very good.
इसको minimize कर देंगे. But then sometimes the audio मैंने off किया हुआ है इसमें.
I can't solve it from the side.
That's what I was saying. ये जो इधर आ जाता है ना, it hides it.
That's what people are saying. The ball. This is
You
what
can see.
other moment is in the real super major.
Right.
That is only for you.
And then it comes on my slides. That is why I was thinking.
Dr. Tapaswini, it's coming very clear.
Thank you, ma'am. Thank you. I hope it runs without any flaws.
Hmm.
इसको हम ऊपर ले जा सकते हैं something about because it will hide my ये जो है ना स्लाइड्स को हाइड करने कैसे देखिए कौन one how are you seeing it?
I'm seeing it first movie.
I can't see myself in that film क्या हुआ है
Not see yours.
recording में आ रही है recording में मेरा भी face
This is what you're going to do.
मैं ही नहीं लिखूंगी मुझे पता नहीं चला मैं क्या देख रही हूँ
This is how you set things. Expansion.
ठीक है like only face पे light आ गई
It is over. Yeah.
backdrop
Yeah.
picture का
This is the question.
Dr. Tapaswini, once you are ready, let me know and we'll start the session.
yeah I'm all set sir hello
Yeah,
hello
so do you, I mean, you are very well audible. I mean, shall we start the session now?
yeah I mean am I audible enough
Very much, very
okay
well audible. Yes,
all right right so it's absolutely your discretion when you want to start the program
correct. Right, all right. Thank you so very much. Friends, good evening. I am Shrenik, patient advocate and moderator of Indian Cancer Society, Delhi branch. I am so glad to mention that today is our back-to-back 24th session on Fridays with Shrenik, and we are having a commendable, highly experienced, soft-spoken Dr. Tapaswini Pradhan, a cancer surgeon for with the experience of over 25 years in head surgical oncology. And before I introduce her further, on behalf of the Indian Cancer Society, Delhi branch, chairperson Jyotaji, Operation Head Priya Parmar, and entire team of Indian Cancer Society, I wish you happy Holi filled with not only with the vibrant colors but flavors, fragrance, healthy life, and happiness till next holy. So, I'm so pleased to welcome Dr. Tapaswini Pradhan today to our session and aligning with the today's Holy celebration. She is going to speak about holistic healing. In the field of oncology, especially for cancer patient survivors and of course last but not least, even for caregivers. Uh, Dr. Pradhan, welcome on board, and platform is all yours. Please, we are looking forward to listen to your wisdom and everything about holistic healing. Thank you for joining.
Thank you, Shrenik sir, and thanks to the entire organization, especially Shrenik sir, Madam Jyotsna, and I have a soft corner for her, Priya ji, and everybody who's present today. Well, happy Holi, and I'm sure the colors of Holi would all shade our lives too. And the topic that you chose is very close to my heart, and that's holistic healing. So, if we look at the disease, cancer, it is something which forces every individual who's afflicted with this disease to relook into one's own way of living. And if you look at the recovery post treatment, the recovery is full of challenges. And it's picking up life after the onslaught of cancer is a major issue. Restoring one's confidence into one's own life and banishing all the ill thoughts of future, that's also another challenge for all the patients. So what's the initial reaction which every individual has when he or she is diagnosed with cancer? And that's a state of shock and disbelief. This was something very beautiful which I want to share. It's part from my own interview where I had interviewed a gentleman who was the COO of IBM, and I asked him how did he react when he was diagnosed. He says, I will put it in an acronym: ABCDEF. So A stood for anger and anxiety. It's like, why me? And the second B stands for breakdown and let down. You feel why cancer should at all, if at all, why at all it has to be me today. C is confusion, utter confusion. D is depression and loneliness. E stands for the initial emotional response that you have. And that's a feeling of loss, and there is grief. And then F is the fear which surrounds you. The fear of death, the fear of uncertainty, and that leads to lack and loss of sleep. And it's quite understandable why these emotions happen because it's a life threatening disease. There is uncertainty in the prognosis of the patients, and also there is a fear of death. In, in fact, nobody knows what's at the end of the tunnel. Is there a light? Is there a hope? So this is what leads to what we call as cancer distress, which affects the emotional, physical, and the social well-being of the patient. There are so many questions. There are so many questions which haunt the individual. Will my cancer come back? Will I be able to pay my medical bills? What will happen to my relationships? What will happen to my the place of work? Will my employer employ me again? And will I be able to carry out my day-to-day activities? Will I be able to take care of my family? So there are so many questions which keep haunting an individual. And then this distress interferes with coping mechanisms of cancer. And it is said that there are so many patients who actually need a psychological and an emotional support. Who are the vulnerable group? Patients who are young, females, those on palliative care, those who have advanced diseases, diseases which lead to a lot of disability and discomfort, those who do not have good social backups, patients who have had some recent life events, losses in their family, who are pessimistic in their approach, who have a poor socioeconomic status, or who are indulging in various habits like drugs, tobacco, alcoholism, etc. So, if we look at the real data and the picture, cancer is on a rise. So, from a value of 13.9 in 2020, we will be at 15.7 lakhs by 2025. And the main reasons quoted are one is our changing lifestyle, the habits, and also increasing life expectancy. And if we look at the figure quoted by National Cancer Registry, it says 1 in 8 Indians will have cancer in their lifetime. Now, I deal with head and neck cancer, so the pertinent issues, and in fact, the treatment of this particular disease has a profound effect on the quality of life of the patients. The major thing is this is the part of our body which can never be hidden. This is what identifies an individual. So, any sort of a surgical procedure we do does get manifested either in the form of some amount of disfigurement of the face, or there is some distortion of speech, loss of taste and appetite, some difficulty in swallowing, and there may be some stiffness of the tissues. So, patients go into chronic stress. And what does this chronic stress do? So it activates our sympathetic nervous system. As a result, there's a lot of production of noradrenaline, cortisol, and this promotes and this stimulates cancer proliferation and cancer invasion. It also stimulates a process which is called angiogenesis, where the tumor cells produce certain substances which increases its own vascularity and which in turn gives more nutrition to the cancer cells and also facilitates their metastasis from one place to the other. And then the other is there's a lot of inflammation. So these inflammatory products produced also stimulate cancer proliferation and cancer progression. And there is reduced immunity. And finally, it reduces also the efficacy of the treatment. As a result, the distress of cancer leads to a worse clinical outcome. How does one conquer this disease? I think there are three things that which every individual needs, not just for fighting a disease, even in otherwise in our life. One is faith, faith that you can fight this disease. And the second is your willpower. And the third is you need to be imaginative. The pause which God gives you when you have cancer, it's like a break in your life. So, how does one circumvent or how does one negotiate this period of crisis? You need to be really imaginative. So, this is again, this is not my words, but this is another patient's word, which he said. The 6-lettered word cancer can be fought with another 6-lettered word, which is called prayer. And this prayer, the P stands for positivity, R stands for taking control of your own self, A stands for adapting to the new changes which the body undergoes following treatment. Y is you reinvent yourself. You try to analyze, you try to discover your inner potentials. E is you learn to engage yourself in various activities. And R is God gives you some time to spend with your own loved ones, that is, rejoicing with your family. And that's one reason when we look at this particular disease, it actually requires what we call as holistic approach. So it's not just treating the body of the individual, it's also treating the physical, the emotional, and the spiritual aspect. So holistic health was something which is quite an old concept, but we lost it because of the Western medicine creeping into our system. And that's again coming back, and we are realizing what is the importance of having a holistic approach to any disease. That's a statement which Plato also made. No attempt should be made to treat the body without treating the soul. So, if we look at diseases and cancer as a whole, we've realized not everybody can be cured. Patients can be treated, but when we consider the cure of cancer, not everyone can be cured, but everyone can be healed, because healing is something which is divine and healing is something which is purely spiritual. So the human body, it's beautifully engineered. I think we should all respect how God has created us. And the diseases which we are afflicted with is actually a reflection of the mistakes that we make. So pain and suffering are nothing but they are our wake-up calls. Till the time body signals, we just take it for granted. And that's why it is said we should respect our own system. Charak, who was a renowned Ayurveda physician, what did he say? When we say health, it actually means the body, mind, the sense organ, and the soul is at ease. But if one of them is not in a proper order, and then it's called dis-ease, and that's how we get disease. So that's another thing which I want to say. This is what holistic health would mean, incorporating all these things and all these aspects whenever we are treating an individual. So most of our diseases, we have realized it has become lifestyle disease. Though we have so much of commercialization, urbanization, which has added to our comfort, but then it has also gotten a baggage of lifestyle diseases, and cancer is one of them. So when we talk about lifestyle medicine, there are certain issues that we need to address. One, are we eating healthy? Are we physically active? Are we able to manage our stress factors? Are we into some sort of a substance abuse? How's our sleep? And do we have a strong support system? So, besides health, what we really talk about in times of now is our well being. So, how is it different from health? So, well being is when you judge life positively and you feel that good feeling of being happy and good. How does that happen? When you fill yourself with a lot of positive emotions and moods like contentment, happiness, sympathy, generosity, selflessness. But when the body is full of negative emotions like fear, depression, anxiety, jealousy, frustration, definitely you will never be in the sense, you'll never feel well in that aspect. So these are, having positive emotion is actually considered as tonic for good health. And that's why it is said positive emotions cause wellness and negative emotions bring illness. But what's very beautiful in this journey is a lot of people discover themselves. And it is said that tough times and the hardest moments bring out the best in different individuals. And in fact, some people appreciate life more after they have gone through this disease. But in the whole game, we would realize what's important, and that's the state of our mind. That's the single most important factor which affects our physical health. And Joseph Montag said, stomach ulcers are a result of what eats you and not due to what you eat. So that's what the root cause of our suffering is, our thoughts. You may be eating the best of the diets, maybe exercising, doing everything, but then unless you do a mind control, a lot of things go haywire. So we all put a lot of emphasis on our physical well-being. What's also important and what takes a backseat is our mind control. And the true fact is the remote control of our mind is all within us. So it's like a monkey. The mind is like a monkey and it keeps on, it's a pendulum, it swings on the past and the future, but we forget the present. And that's why it is said mind can be your best friend or it can be your worst enemy. It can cause or it can cure a disease. And if the mind is calm, it is focused, self directed, it's peaceful, and you experience divinity. So, how does one actually handle a stressful situation like this? One is your approach, positive approach. The same two individuals may see the same situation in two different ways. It's like seeing a glass which is half empty or seeing a glass half full. I think the same situation is being interpreted very differently. One is giving you a very positive vibe, and the other is giving you a very negative vibe. And the other is not to get over emotional on any situation that we land up with. And the third is we need to reframe the problem. So if cancer has struck us, I think we can reframe the problem and see it as an opportunity also to learn from what life is giving us at this point of time. Are there de-stressing measures? Yes. Prayers, yoga, exercise, meditation, music therapy. And they've all been scientifically proven that when practiced, it improves the cancer-related fatigue. It reduces the requirement of painkillers. It improves the mental well-being and also overall quality of life of individuals. Prayers and the various mantras. Often people do a lot of chanting during this process. What does mantra mean? Man is mind and tra means freedom. So you're freeing the mind from various different negative thoughts. And gradually, as you keep on practicing these mantras, you will start feeling stronger and more healthier. Meditation. A lot of people think meditation means going to the mountains and the Himalayas and sitting like a sadhu and practicing in loneliness. No. Meditation can be done in different forms, but you just need to be you just need to be silently sitting, or you could be focused on any particular activity. So when your mind is focused, scientifically it has been seen that there are a lot of changes which happen in the human system. The EEG has shown that there are calming of the brain waves, the blood pressure of the individual drops down, the muscle tone, the heartbeat, and the breathing rate also get altered. It's not moving. Sorry. And then what other thing which happens physiologically, they have seen there is a change in the structure of the brain. So the happiness center and the well-being centers become thicker and also stronger. So it acts like a stress buster, disciplines an individual, makes the sleep pattern more healthy, and reduces your pain killer requirement. And also, it increases the production of melatonin. And what does melatonin do? It has got anti-cancer properties. It also improves your immune system, and it protects the entire hematopoietic system from getting adversely affected by the side effects of the chemotherapeutic drugs. Physical activity. So we also emphasize a lot on doing a lot of physical activity. So that's one beautiful way of overcoming one's stress and anxiety. But physical activity improves the blood flow to the brain. As a result, it stimulates the entire nervous system. It triggers the adrenaline production, which uplifts the moods of an individual, and also increases the secretion of endorphins. And these are the happy hormones, which improves your thoughts, which clears off all your negative thoughts and floods your mind with a lot of positivity. Yoga. Yoga is it's a Sanskrit word which means to yoke, to join. So it's joining the mind and the body. So it's a synchronization of the body, mind, and the breath. And this is the science of right living. And also it's the need of the hour. What does it do? So there is a distinct role. It causes spiritual rejuvenation. It unleashes a lot of latent energy of an individual, increases one's perseverance, resilience, and also ability of an individual to accept failures in life. If you look at the role of yoga and cancer, a lot of studies have been done, a lot of randomized control studies have shown that yoga improves the health related quality of life of an individual suffering from cancer. It decreases anxiety, reduces depression, reduces stress, and also his psychological distress. When seen in children, children become more energetic. Despite the chronic illness, you will find that the mobility of a child is much better. They socialize and also are quite playful and joyful and love to participate in a lot of various activities. So this was an assignment which was done to see, this was a study which was to see what is yoga to sleep quality. So in a cancer patient who practices this, it has shown that it improves the sleep quality and reduces the need for sleep medication. There are different postures, and these yoga postures actually increase the thalamic GABA levels, which improves the mood, and also the anxiety scales become lesser. In children, as we have already said, it improves sleep, it reduces the fatigue. Again, depression, distress, and anxiety all get lowered. So these are various trials which have repeatedly proven these factors. So there is improved cortisol regulation, there is reduced inflammatory product production, there's increased pain tolerance, and there is improved immune response. So concluding, what yoga does is it's not curative. So people should not carry this message that yoga is going to treat cancer. But then there are a lot of things that is important, which we should remember, is that it reduces patients' agony, helps them to cope up with stress. It improves their quality of life. It adds meaning to life. And also, it harmonizes the body, mind, and the soul. So, as we were talking about sleep, why is sleep important? It is something, it is an essential, it is essential, it's not a luxury, but it improves the oxygen supply to the brain, and it rinses the toxins from the brain and repairs a lot of damaged neural cells. And the individual becomes more productive. So it also increases the productivity and creativity of the individual. Now, the last that I'm going to take is on the diet. So we'll quickly move on the diet and see what sort of a diet should a cancer patient resort to, and also answer the question why. So if the human system is to be seen, the body functions when it is acidic, but when we look at optimum health, and that's when the body is in an alkaline state. So too much of acidity, that's going to create a lot of stress and a lot of negative health. One becomes really flustered, mentally disturbed, poor immune function, and you are prone to infections. But when the body is alkaline, so when the body is alkaline, the immune system becomes stronger. Your digestion becomes better, patterns are much better. So, how does one get this alkaline state? That's with fruits and vegetables and herbs. Now, looking at various food substances in nature which have anti cancer property, and one of them, which is very much talked about, is turmeric. And that's the Indian spice, the wonder spice, and also called the Indian saffron. So it's got around 14 molecules which are cancer preventive, 12 molecules which have anti-cancer effect. Its use has been seen, scientifically proven in head and neck cancer, breast, gastrointestinal, lung, ovary, melanoma, sarcomas. But the dosage which is recommended is around 25 to 30 grams of haldi every day, which is practically not possible. So what we have in the market is curcumin, which is marketed in the nanoparticle form, and the recommended dose there is 4 to 8 grams per day. Let's look at this beautiful fruit, which is lycopene, and that's tomatoes. So lycopene, how does one get this lycopene? No, it is not available in the raw state. So if you're eating tomatoes in the raw state, that doesn't give you that lycopene which is required as an anti-cancer, like paste or a soup or a sauce, which means you have to heat it. So when tomatoes are heated, that gives a good availability of lycopene. But the do's and don'ts with lycopene is, with tomatoes is, don't heat. The do's is that you have to heat it, but then the don'ts are, don't refrigerate the tomatoes, because the more the red, more the ripe, so more would be your availability of lycopene when you warm them or steam them or you heat them. Don't use the canned tomato products because they contain preservatives. The other rich sources of lycopene are the red colored or the orange colored fruits like watermelon, guavas, bell peppers, and the red grapes. How and where all? Breast cancers, lung cancers, endometrial cancers, prostate cancers. So this has found its utility in all these carcinomas. Resveratrol. If you're looking at grapes, the pink grapes, the grapeseed extracts are rich in resveratrol. And that's why we often tell our patients how red wine can be useful for patients. And it's been seen that head and neck cancers, leukemia, myelomas, pancreatic cancers, there is a role of resveratrol. So the very famous adage, one apple a day keeps the doctor away. But if you look at this apple, it's rich in minerals. There are a lot of vitamins and a lot of dietary fibers. It is the apple skin which is rich in quercetin. Unfortunately, a lot of us peel off the apple thinking that it's got the pesticides and also the wax. But it's actually the apple skin which contains this substance called quercetin, which has got anti-cancer property. Green tea is rich in EGCG, again has been studied, its role has been studied in various cancers, skin, breast, lung, stomach, esophagus, colorectal, pancreatic, and bladder carcinomas. Omega-3 fatty acids rich in walnuts. This is a substance which is not produced in the body, so it has to be externally supplied, also has cancer fighting properties. Garlic. Garlic has what we call as allicin. And allicin, it actually speeds up the DNA repair and is also known to kill the cancer cells. But what we should remember about allicin is when we heat the garlic, it gets destroyed. So what's recommended is crushing the garlic and then consuming it raw. So 2 to 3 or 3 to 4 garlic pieces is good enough per day. Cruciferous vegetables like broccoli, cauliflower, and cabbage. Broccoli has been lot studied, and this has got sulforaphons. And sulforaphons, how does it reach our system is when you steam these broccolis. Broccolis are not to be fried or not to be frozen or not to be eaten raw. So if you want to really benefit out of the plant product with regards to the anti-cancer property, steam the broccoli for 3 to 4 minutes. The other are the folate-rich foods. Folic acid has found a lot of place in the cancer treatment. So vegetables, the green leafy vegetables, beans, papaya, strawberry, walnuts, almonds are all rich in folic acid. So colorectal cancers, breast cancers, the incidence can be lowered. And it has been seen folic acid deficiency, the correlation between folic acid deficiency and cancer has been read in detail. Dietary fibers. We talk a lot about not consuming refined food because they all lack fibers. So taking a good amount of dietary fibers helps us to protect against colorectal cancers. So what's the message? The message is nature has so many fruits and vegetables of varied colors. And that's where we bring out the concept of eat the rainbow concept, which is trying to have a platter which has the various colors of rainbow. So if you have the entire day, the varied colors of rainbow, these are going to be highly protective against this dreadful disease. So eat your food as medicine, otherwise you'll have to eat medicine as your food. So it's important to remember how nature helps us. We have to realize how and what benefits we can reap from learning to consume different food substances in the right manner. One should never take our health and well-being for granted. A message which Kite says, it's a beautiful message. It says, fly high, but stay connected to your roots. So whatever be our scientific advancements, there are so many things that we have now come up with, but then we should not forget our roots. Never forget what Mother Nature has to offer us. So the take-home message for all the listeners is engage yourself in regular physical activity, avoid being overweight, consume plenty of fruits and vegetables, advisable to start during your childhood. Balance your lives intellectually, spiritually, physically, and also undergo regular periodic checkups and participate in the various screening programs. That's a slide which I love to show everybody. And it says, my life isn't perfect, but I'm thankful for whatever I have. That's the feeling of gratitude. I think that's the most important aspect which we all forget. So gratitude, it's always, we are so blessed. We have so many things in our lives, but we still keep grumbling. We are still grumpy about a lot of facts, a lot of things that we don't get, but then we never count on the blessings that we have. So that's the series of my programs and interviews and talks which I had done Some of them are there in the YouTube, and I was very fortunate to have had conducted these interviews. It goes in my name. It's called Dr. Tapaswini's Corner. And I was very fortunate to have been selected from all over India to host this particular program for the Prime Minister. And it's labeled as Arogyavani. Thank you once again. And that's my link of the various social media platforms from where I do some awareness and educative activity. Thank you, and thanks a lot, Shrenik Saab, and also to the entire organization for giving me this chance and the opportunity. Thanks a lot.
Rajani, when I was listening to, you know, I must admit that, at number of occasions I'm mentioning, then, it's all about purity of mind and purity of intentions. The fact is, we were very recently got connected, but, while you were presenting these slides, I felt that, you were rather narrating my own life, my life after cancer, because, everything completely aligned with everything you said. And the three takeaways as of today: number one, A, B, C, D, E, F; number two, prayer; and one of the most important thing as of today is, today being a holy day, it like a rainbow. So these are, commendable takeaways for everyone present. And yes, one more point I would like to add here, that when you want to distress cancer, you don't need to go to IIM Ahmedabad or Harvard or Cambridge or Oxford University. You have to simply follow everything Dr. Tapaswini she has mentioned in 35 minutes, which is to me is like a complete encyclopedia of distressing the cancer. Thank you so very much. I cannot thank you enough for your time and everything you shared today. Thank you.
Thank
And
you.
Priya, let's open the room for questions from everyone.
Yes, Dr. Santosh Sahi wants to ask a question. Dr. Santosh, unmute yourself.
Yes. Well, I mean, no doubt, very holistic approach and enjoyed every bit of the talk. I just wanted to add you that in our uh, Prashanti, the rehab center, we are using a lot of laughter therapy with children. And as you know, it has all the benefits which you have given for yoga. I mean, like, release of endorphins, depression of cortisol, serotonin, oxytocin, and all those good hormones are. So I wish if you could give me a chance, and I would love to give a demo and show you how easy and full of fun and masti the sessions are, and it gives instant change of mood. So this was my
Absolutely.
just request. If you give me some opportunity to show you that it is very, very efficient and beneficial like your other therapies. Thank you so much for such a holistic program. Really enjoyed very much.
Lovely. Yes, it's scientifically also proven, a smile, just
Yeah.
smiling. The smiling itself, the act of the smiling produces a lot of endorphins, and these are happy hormones.
Yeah.
So I'm
Yeah.
sure laughter again, it's going to double up your hormonal release.
Absolutely.
Uh, 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 Dr. Tapaswini,
Yes, madam.
how are you?
Good.
Very
Lovely to
peaceful
see
talk,
you.
like always. I just want to ask you one question, Tapaswi.
Yeah,
I remember you were the one who got me started on haldi.
right.
And but I just want to ask you, is like I have it as in a powder form. Is that as good?
Powder form meaning, is that
The,
your own
uh-huh. No,
homeish? Yeah,
organic, from a reliable source.
yeah. So there are, because now that it's proven that it's got it's got an anti-cancer property. So every nick and corner, every pharmaceutical company is coming out with some or the other,
Mm-hmm.
you know,
Mm-hmm.
drug which has curcumin.
Mm-hmm.
But let me tell you a couple of things on this particular thing. Haldi. Many of us, most of my patients say that we are consuming haldi. So why should we take these capsules otherwise? There is a difference. Now, the haldi that we take doesn't get really absorbed by the body. In fact, 70 to 80% is excreted out. And that's the reason why the scientific forum found out that the substance which is anti cancer in haldi is curcumin. That's the chemical compound which is anti cancer. So, this is now being extracted and it's packed in various capsule forms. And it's the nanotechnology, again, which is a better version of curcumin. Through nanotechnology, they have been able to increase the bioavailability of curcumin. Because earlier, curcumin was being combined with piperin, which is black pepper. But black pepper itself causes gastritis and curcumin also. So the two together were producing a lot of gastritis. So with the nanotechnology, they've realized that you can obviate the need of piperin and increase the bioavailability of curcumin. And that's how it is different from taking haldi every day. So, if you were to take haldi for an anti cancer, can you imagine taking 25 to 30 grams? It is not humanly possible. So, when you take it in the form of curcumin per se, so the requirement is around 4 to 8 grams. So every taking it in a powdered form, I don't know which company is this, how is it being manufactured? But what we need to look into is how is it being produced? Is the nanotechnology being utilized in its production? Secondly, what combination are they using? Are they adding piperin? If you are saying that it's a nanotechnology and you're also adding piperin, there is some little mistake here because nanotechnology came in to obviate the need of piperin so that the gastric element, which is produced because of curcumin, should get reduced and your acceptance to this particular drug would be higher. That is another reason why we ask all these capsules to be taken after a heavy meal. If you take it empty stomach, it produces severe burning in the stomach. So never take it empty stomach. Always take it after you've taken a good meal. So, Sangeeta ma'am, I may not be able to comment on what powder is this because one needs to check it out. But let me tell you, every company has now started producing haldi curcumin. But you really need to look into which company is this. Is it really genuine? Because it's got a lot of commercial value and a sale value. So every next door pharmaceutical company has now come up with curcumin preparation. So be careful in what you are using.
Thank you. Thank you very much.
Dr. Tapaswini, I have a query.
Yes.
A young person who has been diagnosed with fourth stage of cancer
Right.
will obviously have a lot of depression and will be put on antidepressives. How can they look at life in a positive way?
See, stage 4 cancer does not mean a death sentence or end of the tunnel. The most important aspect here is who is the treating clinician. A lot depends upon the person who is treating him or the person who's the main point of contact. So, how much of positivity can we infuse in an individual? And stage 4 of every cancer is different. You talk about a stage 4 head and neck, stage 4 breast, stage 4 lung, and also the cancer subtypes. So, all of them cannot be compared, they all behave very differently. So, that is one reason why we tell our patients. I generally hide the stage. I tell the caregivers more than the patient. Because if you tell it's a stage 4 disease, they think that it's the end of the world. But it may not be. A stage 4, like in our head and neck, will have a 50-50% chance of survival. So this 50, that individual may be in the 50, which is positive, and the other individual may be in the 50, which is negative. So how are we at this point of time gauging which side of the bracket is he on? So we are not here to destine or predestine anybody's, future. But the most important thing which every clinician should do is a lot of positivity in the minds of the patient. Tell them that it is treatable. Cancers are treatable. The cure part is not to be very much discussed, because that may be a very disheartening sort of a thing, because that only time tells us. So if you fill a patient with positivity, this positivity itself will give him so much of energy. It'll boost his immune system and will work miracles on his system. So I would say that never should you feel at loss if it is a stage 4 disease. Even a stage 4 can have a good prognosis. And the stage 4 has many different stage 4s, because these are pathological factors. There are many pathological factors which are good, yet stage 4. There are some pathological factors which make the patient come into stage 4, but they are bad. So it is time, let time decide which side of the bracket the patient would be on. But I would say just tell the patient, fill the patient with all positivity, with positive vibes, give them a right guidance how to go about in their treatment. That's important, because a lot of people run away and take it to alternate treatments. They'll go to Ayurveda, homeopathy, or they think it can't be treated, so let me go for a Tibetan medicine. No, I think we are here to guide the individual, but we are not here to destine to tell him about his own destiny. So my point is, just tell the patient, be a fighter and fight it.
Thank you.
Priya, I want to endorse I want to completely endorse what Dr. Tapaswini has mentioned. Now, I am stage 4 vocal cord cancer survivor, and I am in my 28th year. So, it's all about destiny and how positive you are, and accepting the challenges and making the best out of the disease. So that's it. Thank you. So, any new questions? Dr. Jotaji, I would like to speak a bit.
Thank you, Shrenik. I just want to mention, Tapaswini, that
Yes, ma'am.
everything you have said applies to people who have no cancer.
Yeah.
No cancer. It's a way of life. It's what our ancestors lived by. So, yes, it helps in cancer simply because we have lost the way in between and taken a wrong turn. But at the end of the day, everybody, and I'm saying everybody, will benefit from all the advice that you have given.
Absolutely. That is why at the start itself, I said cancer takes you through a journey which makes you relook into the into
Yes.
your way of living.
Hmm. Yeah.
Yeah.
But there are many people on this in the audience who think that this is specific to cancer. And I just want to make the point every one of us can benefit from everything that you have said. So thank
Absolutely.
you very much.
Absolutely.
Right.
Uh,
Absolutely.
Priya, any further questions? Priya, you're remote. You're unmute.
Well, Dr. Tapaswini, we've got a message from Peter from Nairobi, who has found this quite informative and would want a record of your presentation.
Okay.
Tell him to go to YouTube.
Yeah, we are streaming live there.
We're streaming live. That's wonderful that your talk is going around the world.
Thank you, ma'am.
Shrenik, any queries from you?
No, I don't think so. I mean, I would like to wrap up the session. It's close to 7 now. So thank you so very much, everyone. Wishing you happy Holi and Dr. Tapaswini. It was commendable
Thank you, sir.
takeaway. Uh, it was not only for cancer patient survivors, but for everyone concerned, or
Everyone.
rather everyone living on this planet to lead quality life with or without cancer. So thank you so very much. I am deeply grateful on behalf of ICS Delhi for giving your time and enlightening us with your knowledge, expertise, and everything to lead quality life even after cancer. Thank you.
Thank you so much, Shrenik, sir, for giving me this chance and the opportunity. Thank you, Jyotsna
Thank,
ma'am, Priya ma'am, Sangeeta ma'am, and everybody from the Indian Cancer Society. Thank you
thank
so
you. Thank you
much.
very much,
Thank
Dr.
you.
Tapaswini, you're one of us. So you can thank yourself also. Thank you very much.
Uh,
Thank you.
but doctor, sorry, Jyotaji, yes, she is one of ICS, but I am having a privilege of bringing her today to ICS. So, thank
Hey,
you so much,
if
everyone.
you had this advantage by joining ICS. You meet wonderful people.
Jyotaji, say I am a businessman. I am a
अरे
businessman, and
कुछ
I don't make mistake in
नहीं
taking
बनाने
decision.
ब्रेड
And
है
I'm deeply
अगर नहीं है
honored
तो ब्रेड ले
and
आ और
grateful
थोड़ा
to
पनीर ले आ
IJ Delhi and particularly to Priya for
5
bringing
बजे
me on
कितने बजे
board.
4 बजे तक आया
Right.
Thank you.
अगर होगा तो मैं वो लूंगी थोड़ा सा सैंडविच
Thank
Bye
you.
bye
Thank you,
everyone.
थैंक
everyone.
यू
Okay,
Okay,
Bye.
bye.
thank you,
Bye
Bye.
bye
Tapaswini.
bye.
Thank you.
Bye. Bye.
Bye bye.
Bye.
enjoyed every bit of it
Thank you. Thank you.